Hello everybody. Today we shall discuss about screening and diagnosis of breast cancer. Screening is done for asymptomatic individuals. It is done before the onset of symptoms. Generally it is done for the population. However, we do not have a nationwide screening program in India just because of the sheer population we have and breast cancer not being a public health problem in India. We have with us mammogram or sonomammogram, MRI and breast self-examination as screening tools. We shall discuss few points about breast self-examination. It helps in reporting any changes that one notices. Studies have not shown that breast self-examination reduces the mortality from breast cancer. However, it should be advocated in India because we see advanced cases, and if breast self-examination is taught and done properly, we can detect lumps at early stages. And how to do breast self-examination? One should do on the 10th day of menstrual cycle every month, standing in front of the mirror, and should bring to notice if they find any changes. This may lead to more visits to clinicians and more tests. However, it's worth doing because we can detect lumps in early stages of development. Coming to sonomammogram or mammogram, less than 40 years of age, it's not advocated, and the breast is generally dense and mammogram should not be done. It will not be informative. And between 40 to 50 years of age, it's controversial whether to do any screening, but it's worthwhile to do sonomammogram once a year. Mammogram may not be informative because the breast is still dense. And more than 50 years of age, annual mammogram is advised, and if 3 consecutive mammograms are done, it can be relaxed to once in 2 years. So that is the screening recommendation for breast cancer. And MRI is used along with mammogram to screen women who are at high risk for getting breast cancer. They are not used for women at average risk. And this is the general recommendation and updated guidelines about breast cancer screening. It keeps changing. However, to summarize, less than 40 years of age, no screening is required except for individuals who are at high risk, that is with strong family history of breast and ovarian cancer, or somebody has a BRCA mutation. And 40 to 50 years of age, one can go for annual sonomammogram, that is ultrasound examination. And after the age of 50 years, one can go for annual mammogram. And MRI is reserved for individuals who are at high risk of breast cancer, such as individuals with BRCA1 and 2 mutation. So that is about screening. Coming to diagnosis, how we diagnose breast cancer. Diagnosis is done after the onset of symptoms. And we do have what is called as triple test, that is clinical examination, mammogram and FNAC. If these 3 are judiciously done, the chances of missing a malignancy is almost remote, because the sensitivity and specificity of this triple test is almost 99%. And biopsy is done to know more information about the subtype of breast cancer and also to do further studies on the tissue. This is how a typical mammogram looks like. The breast is not dense and we can notice a speculated mass in the breast. Biopsy, as I already told you, is the diagnostic test for diagnosis of breast cancer. It gives us information about the histopathology, the subtype of breast cancer, and also we can do further tests on that, that is estrogen receptor, progesterone receptor, HER2/neu and Ki67, which will guide us in the further management of breast cancer. Thank you.